So, hi everyone. Welcome to another session of Shadowers, and today we have Eisen with us. And thank you so much for taking your time, and thank you everyone for tuning in. And whenever you're ready, you're free to take it.
Okay. Hi, guys. My name is Dr. Eisen, Ron Eisen. Thanks for having me. I'm a general dentist. I do a lot of cosmetics and implant dentistry. I don't know what happened with my slideshow, why everything kind of moved to the side, but hopefully that's okay for the rest of the stuff. I'm in Orange County, Southern California, and I graduated dental school a little over 3 or 4 years ago now, so I'm not too far away from where you guys are. I know a lot of you guys are in college, or you maybe just graduated and trying to get back into dentistry. So hopefully I can answer a lot of your questions. And if anyone has a question and wants me to answer, maybe message one of the moderators, let them know they can stop me, and I'd be happy to answer any questions at any time. All right, so I'm just gonna give a little intro, kind of outline of what I'm gonna talk about today. So talk about myself real quick, so you guys can get to know me a little more. What I do, my advice that I give to people that are in college that are pre-dental. I'm gonna talk about some cases that I have, and that can answer any and all questions. And I'm pretty blunt and I'm super honest, so I promise ask any questions you want. I will answer them 100% as honestly as I can, and I think I can give some good insight. Okay, so a little about me. Like I said, I'm a cosmetic and implant dentist. I'm technically a general dentist, but I focus on cosmetics and implants, oral surgery. So what I like to do. I'm from Newport Beach, California. I went to USC, University of Southern California, for college. And then I went to UOP, School of Dentistry in San Francisco. Awesome school. And then I did my AEGD residency at UCLA. They have a Venice clinic there, and so I finished off there. And then now I've moved back to Newport. So what is general dentistry? Like I said, I focus on oral surgery and cosmetics, but general dentistry is kind of what the name says. It's dentistry in pretty much everything. What I really love about being a general dentist is you can do whatever you want in dentistry. You like fillings, do fillings. You like crowns, do crowns. You like root canals, do root canals. You like oral surgery like myself, do oral surgery. You like veneers like I like to do veneers. You can focus on whatever you want to do in dentistry, which is amazing, as long as you have the experience and skill set and knowledge to treat your patients well. And I think that's one of the best parts of being a general dentist. I personally actually like the variety of being a general dentist, and so I like doing everything in dentistry, although I do like some things more than others. And so I've kind of tailored my practice to kind of gear myself towards those things so I have more fun doing what I do. What education did I need to get to where I am? Well, college, dental school. And then I have a pretty, let's call it a focused skill set in oral surgery. So I did an AEGD, which is an advanced education in general dentistry. You don't need to think about that too much now, but know when you're in dental school, that's an option for you. It's another year of a residency after dental school to fine tune and hone your skills and get some more knowledge. Another version of that is called a GPR, and that's a little more hospital based, but I'm happy to answer more questions about that if you guys like later. But by no means, you don't have to do an AEGD or a GPR if you don't want to. You can graduate dental school and then just take some really great continuing education or CE courses. And if you find some great CE courses, you can learn a lot of amazing things. I have taken awesome courses, and I felt comfortable doing some big surgeries right after, and it was amazing. And then finally, if you're super lucky, you can have a fantastic mentor. And a great mentor can actually teach you everything you need to know. If they're willing to teach and you're willing to learn and put the work in, you don't even need to do any of the residencies or CEs. They can give you the skill set that you need or that can help you succeed and do some really great things. So kind of any of those three or a combination will get you to kind of where I am today. So they asked me what a typical day is, and what I love is, for me, there is no typical day. Every day is kind of different. You really don't know what to expect, but I love it because none of my days are mundane. None of my weeks are the same. and it makes it so much fun for me. I don't get bored. Some people get bored of the office, like back in their 9 to 5 in the cubicle office. In dentistry, at least the way I am, it's definitely not boring. Everything is kind of new every day. My practice is I try to be able to provide everything a patient needs in one office. I like to think of it as a one-stop shop. You need a root canal, we can help you. You need a filling, we can help you. You need your cleaning. I don't do cleanings, but my hygienist does. We can help you. You need surgery, you need implants, we got you. You want to do cosmetics, we're here for you. I don't want my patients to get referred out. I don't want patients to have to go to another office, drive away, whatever else. Patients love coming to my office to get all of their dental needs taken care of. Although, like I said, no day is the same, I had kind of have tailored my practice for me to do a lot of oral surgery. So I'm doing a lot of implants. I take out a lot of wisdom teeth, doing a good amount of cosmetics, veneers or full mouth reconstructions, normal restorative, which is like crown and bridge and fillings, and some root canals. But seriously, like I said, the best part of being a general dentist is you can do whatever interests you. I think that is amazing. So a little advice for you college students that want to get into dentistry and you want to make your application stand out or look better or have the best chance to get into a good dental school. These are my top things. So I say shadow a dentist. Right now you're in this dental shadowing group, which is great. I think with COVID and all the virtual stuff going on, I think this is amazing. So you guys are already off to a good start. But if you're able to get into an actual office and shadow a dentist in person, that's even better. If you can find a dentist that's willing to work until let you watch, or if you can maybe even work at the dental office, make sure you love being a dentist. You want to be a dentist. While I love being a dentist, many people don't and would not like it. And so if you get into this career not liking it, you're going to be screwed, to be blunt. It's a very demanding, not easy job. And if you don't love it, it is not going to be fun for you. And dental schools know that. So dental schools want to know that you actually know what being a dentist is like. And shadowing a dentist proves that. If you have hours of shadowing, you're proving to dental schools that you actually know what being a dentist is like and you actually want to do that. Some people want to be dentists because they think we make a lot of money. And I mean, I make pretty good money, don't get me wrong. And a lot of dentists make some very good money, but some don't. It's not only about the money. And the money is not worth it at all if you don't like what you're doing. So make sure you want to be a dentist. I always recommend if you can be a dental assistant, so you're the person that's assisting the dentist, so you're chair side with the dentist, watching what they do, helping them. All my classmates that did that were so far ahead of the rest of us when they were in dental school. The first year of dental school was hell for a lot of us, but it was so easy for them because they already kind of knew dentistry. It wasn't like learning a new language for them, while for us, it was like learning a new language. So if you can assist, you will be light years ahead of your future classmates. I recommend joining a pre-dental club. I was part of a pre-dental club at my college at USC. I got some incredible experience out of that. I got exposed to so much dentistry in different ways. We did volunteer trips together. We went to the USC dental school, so I got to talk to dental students and see what that was like. It was really, really helpful to be a part of the dental club. And I was with like-minded people who wanted to be dentists too. And so we all helped each other out and it was really helpful. And if you have a dental club at your school, I highly recommend joining. Going into, I also recommend volunteering if you can. Maybe talking to the nearest dental school and seeing if you can help out and volunteer in some way. There's so many dental volunteer mission trips out there. I've done countless. Try to do that. It looks great on your resume. You're being a good person and you're getting your feet wet in the world of dentistry. Needless to say, get the best grades you can. You don't have to have perfect grades by any means, but the better grades you get, the easier it is to get into dental school and the better school you can get into. I wouldn't stress and kill yourself over getting perfect grades, but just definitely study. So that's all for actually being a good applicant. And then, but the rest of my advice for you guys in college is really take care of yourself mentally and physically. Go to the gym, go on runs, take care of your body. If your body is weak, if you are not in good shape, you're not going to be able to handle dentistry, honestly. I mean, I know there's a lot of fat dentists out there and stuff, but they have back problems, they have neck problems, shoulder problems. Take care of yourself. If you are healthy, then you can better treat your patients and you can last and have a longer career instead of having a short career that has to end because you're physically not able to do the job. Take care of yourself mentally. I mean, college is hard. There's a lot of studying going on, but make sure you take some, sorry for my dog over there. Take some time for yourself. Make sure that you guys are okay. Make sure that you're happy. Don't kill yourself over studying. College is so much fun. Life is so much fun. Make sure that you enjoy the fun parts of life too, and not just kill yourself over studying. And like I said before, make sure dentistry is something you want to do. I think it just goes without saying. So let's go into my cases. I got 5 cool cases for you guys. I have a lot, but I picked 5. I think they give you guys a wide range of what I do. I'm going to try not to talk too much in dental terminology because I know you guys are not in dental school yet, so I don't want to like overwhelm you guys or confuse you guys. So I'm going to try to kind of put everything in layman's terms. If I don't and you guys don't understand something, please stop me. I'll be happy to explain it. Or in the Q&A, if you guys want to mark down some stuff, I'm happy to talk about everything. So case number 1, really great case. Honestly, nothing too crazy going on here. This was a girl. She was 23 years old, beautiful girl. She just did not like her smile. She actually hated her smile. And in her eyes, and I completely agree, her teeth were too small. There were gaps in her teeth, and it made her look really young. She had a very youthful look. She's 23, but she looked, because of her smile, more like 18, and she didn't like that. So what do we do for her? This is a great, straightforward veneer case. I did 10 veneers, nice and conservative, nothing too crazy. We did veneers from here, second premolar to second premolar. Gave her a much more full, bright smile that still looks nice and natural. I love this case. Looking at the bottom, you are not going to tell me that these are veneers. They look nice and natural. It really matched her teeth, her face, and she could not stop smiling. And this is what I love about being a dentist, and especially a cosmetic dentist, because it's the most rewarding in the quickest way. In 2-3 weeks, this patient was ecstatic. We videoed her, and she said that she finally has confidence, and she literally got a promotion, or actually I think she got a better job after this because she had more confidence. And it's just really, really cool to see someone get their confidence up because of their smile. And that's probably my favorite feeling in dentistry, is really seeing someone's confidence get a nice boost. So that's case number 1. Great case. This is a very cool case for me. I actually posted on my Instagram just this picture here, and I put a poll and asked which, I was going to do this to you guys, but I know we can't have so much interaction, so I didn't do that this time. But posted a poll, and I asked which of these teeth, sorry, I did only 1 through 4, these 4 teeth. So which of these 4 teeth are the implant? And I'm not kidding you guys, 85% of people got it wrong. They cannot figure out which one was the implant. And that's including a lot of cosmetic dentists. They could not tell. And here, obviously, since you guys have the before and after, is the implant. So this patient right here had a car accident, lost her front tooth in a car accident, had just a flipper, which is kind of like a removable tooth that she's been wearing for years. She's been missing this tooth for 4 or 5 years. It's a tough case. Matching a central incisor, which is what these two are, one incisor to the other, and making it look natural with a dental implant, it's probably the hardest thing to do in cosmetic dentistry, well, in my opinion. And I love the result we got. We ended up whitening her teeth a little bit. I actually did a veneer here too because she just did not like her chipping over here. So I did a veneer and a dental implant right here. and she could not be happier. I couldn't be happier either. This looks so nice and natural. It's kind of like what I like to do, is like to make things look better, but still natural, where you'd have to look double time to make sure, is that a dental veneer implant or not? So great case. So nice single tooth implant, veneer, and I think we got a really nice result. This is a bigger case. So sorry for the not beautiful look on the upper. This patient has a lot going on. He had a bridge from this tooth to this tooth with fake teeth that had failed him, had broken off, and now he's in these temporary bad teeth. He's missing a tooth here. All his crowns have decay, all awful. So I ended up doing an implant right here, an implant right here, implant right here. I did an implant bridge, and I replaced all his crowns to give him healthy teeth again. And here we go. I think that's a pretty amazing transformation. It might not be perfect aesthetically. I see a few things that I would want to change or improve, but for his bite, there's only so much we could do. But overall, I think we got a seriously incredible transformation. And you tell me that his quality of life hasn't gone up tenfold because of this. All right, I want to show you guys this case because this is a really cool case that I did in dental school. I want to show you what you guys can do in dental school. So the other cases I've done now in my own practice, but this is back in dental school as a student. I was working with my professors. We did this case. This patient here, I think she's like 30. She fell on her face as a child, which is very common around 8 years old, and ended up pushing these teeth called subluxation, which her teeth got pushed back towards the tongue lingually. And so you can't tell very well, but these two teeth are actually pointed towards her tongue, towards the roof of her mouth, way out of alignment. And obviously they're discolored, don't look so great, and so forth. So in dental school, I ended up doing root canals on these teeth and 2 crowns. Nothing too crazy, very simple. But we also whitened her teeth. And then she also didn't like the sharpness of her canine right here and right here. I actually did some very minor enameloplasty, which is basically just rounding off the enamel or the sharpness on the canine to give her a bit more feminine of a smile. That kind of flowed in her lips a little bit more like that. And that gives it a nice flow overall. Let me whiten her teeth. And then again, look how nice these crowns match her other teeth. Everything looks pretty good. I tried to convince her, and it would have been better if I could do a little gingivectomy to bring the gums up here so we could bring it higher up to match these laterals. She didn't want to pay for it, so that's fine. So there are things we have to make compromises on, but overall, I think it's a nice result. And then finally, my last case for you guys today. I have the surgical photos for this case, and if you guys want that, you guys can message me on Instagram or email me or something, and I'll be happy to show you those. I just want to gross out the people that don't like surgery, so I'm showing you guys the X-ray instead. So this is something called all-on-4. It's basically replacing someone's entire dentition with implants. So this man, he's about 50, 60 years old. He had severe gum disease. His teeth were wiggling in the wind. He would talk, and then as he would hit, his lower teeth would literally wiggle out in front of his face. So there's nothing you can do to save it. So in one day, we put him to sleep, and we took out his entire lower dentition. I shaved down his bone about 5 to 6 millimeters, smoothed it all out, as you can see. Oh, crap, how do I go back? There we go. And as you see these little sockets right here, that's where the teeth were, so forth. And you can't see the front very much because the incisors, I pretty much shaved them all the way down so you can't see it. And then I put 4 implants and then a new set of teeth right here that you can't see all of. That's just the radiograph, so you can see only that part. And he had a whole new set of teeth, walked out later that afternoon, and it's permanent. It's a great, great solution. It's amazing. And this is what a lot of oral surgeons are doing, big time surgeons. And I'm over here as a general dentist doing this too. And why I'm showing you guys this is being a general dentist is freaking awesome. You can do this if you get the training. I mean, don't get me wrong, I had some pretty advanced training to get to this point, but I'm still a general dentist. I'm not an oral surgeon. I just happen to do some things that oral surgeons do as well. And I think it's really cool. This patient could not be happier. He was also very self-conscious of his smile. And if you saw his teeth before, you would know why. It looked disgusting. But now his mouth is healthy. He can chew. He can still eat. He can bite into a sandwich. He can have burgers. He can eat steaks. Overall, awesome, awesome outcome. So these are some of the things. I think it's a great wide variety to show you guys kind of what I do. And it encompasses a lot of things. I love when dentistry brings a lot of different practices together. And so it just worked out well. So some advice to our future dentists, you guys. Find your why. This quote that one of my mentors, his name is Dr. Galler. He's a big time Invisalign orthodontist. He has probably been the most Invisalign in the country, if not the world. I was lucky enough to have him as a mentor at parts of my life. And he said this quote, and it really, really rang true for me. And the quote is, "A perfect, healthy smile enables a person to reach their maximum potential in life." And I truly believe that. What that basically means is a beautiful, healthy mouth or a smile gives someone the confidence that allows them to become the best version of themselves. If you don't have confidence, you can't be the best you. But if you do, now you can really change the world. And so teeth, something super small in the grand scheme of things, can really change someone's confidence. Can make it worse if they're bad, can make it better if they're good. And so I really live by this quote. This is my why I like to do dentistry. Find your why, but also enjoy life while doing it. So thanks for listening. My email, if you guys have any questions, I'm happy to answer. My email is my name, Ron Eisen @yahoo.com. I'll answer maybe in a few days but give me time, but I will answer any emails. If you want to talk to me on Instagram, my personal Instagram is just my name, Ron Eisen. My personal Instagram is not very dental focused, but it has some dentistry on it. You guys are welcome to ask me any questions on there if you'd like. If you want to see my office Instagram, that's dentistry at its finest. My dad is a dentist too, and we work together. So actually, my dad runs that Instagram. So if you message that won't be me. That'll be my dad. But if you want to see a lot of the stuff that our office does, that's a great way to do it. Check us out, and that's pretty much it. Open for questions.
Thank you, Dr. Eisen, for that presentation. We do have some questions for you. So our first question is, what do you find the most challenging about your profession?
I think the most challenging thing in our profession is you're also a psychologist. A lot of patients, for whatever reason, have extreme dental anxiety and are dental phobic. And the moment they walk into your chair, they are scared shitless, to be blunt. And so you have to be able to exude a certain confidence and calmness to keep your patients calm. And sometimes patients are a little bit crazy because of anxiety. Anxiety can make someone crazy. So you have to be a therapist as well as a dentist, as well as an engineer, as well as a bunch of other things. So in my opinion, I think that's the hardest part of being a dentist is actually not the dentistry, but the therapy, psychology aspect of it.
That makes sense. I feel like dentistry, dentists put on a lot of different hats.
Yes,
but,
definitely.
Thank you. And then we have another question. Would you still pursue dentistry if you could go back in time?
Yeah, without a doubt. I love being a dentist. I think it's the perfect career for me. I could not be happier. There were a few avenues I was going to go, but I am so glad I went into dentistry. I'm really serious, guys. It is an amazing career. It will take you many places. It's taken me many places, and I absolutely love it.
That's great to hear. Next, how do you balance work and family life?
Well, I don't have much of a family. I'm a single guy right now, but I still have a lot of balance. What's it called? I work a lot. I work probably 10 hours a day, Monday through Friday. But I like to say, like, work hard, play hard. I travel a lot. I'll take weekends and go traveling somewhere. Sometimes I'll take a week or two off of work and just go travel, have fun. There is definitely enough time, no matter what you do, for family, friends, and yourself. So there's definitely time. It's all about time management, making sure you get your stuff done and prioritizing. Even in dental school, you have time. You think you don't, but you definitely do. It's just if you want to give yourself that time.
Thank you. What was the most challenging aspect of dental school?
For me, the hardest part of dental school was balancing studying for all the book stuff like microbiome, God, I don't remember, physiology, like all that kind of stuff, with all the hand stuff. So while practicing all the drilling, practicing all your preps, practicing crowns. So you're trying to find the time to balance between practicing your stability of your hand for like drilling a filling on these fake teeth in the lab for hours, while you're also trying to study for your midterms or exams or whatever. So kind of finding that time and allotting time to one versus the other, that was challenging for sure. I think that's what makes it so much harder than med school in a lot of ways, is that they're just studying books, while as a dentist, you're studying books and you're practicing in a lab. And it's a huge difference in my opinion. I'm not saying it's harder than being a doctor by any means, or a physician, I guess. But it's just super different. And you have to, like I said before, have a lot of hats and be a balanced person.
Thank you. Someone from our chat is asking, after dental school, do students go straight into practice, or do they have to do a year of residency as a general dentist?
So it's a great question. The answer is you don't have to do anything. You can do whatever you want. If you are comfortable out of dental school to become a general dentist and start practicing, you can go straight to practicing. I personally was actually comfortable. Going to UOP, I was very comfortable as being a dentist. I could have worked right away, but I knew I wanted to get more into oral surgery and have more advanced knowledge in that aspect, which I did not get in dental school. So that's why I did my residency, to get that kind of oral surgery focused knowledge and learn about full mouth reconstruction and stuff like that. But if I did not want that knowledge or information, I easily could have gone out and started practicing. And so the answer is you don't have to do a residency, but if you want to, you definitely can. And it's nice to have if you need more skill or knowledge.
Thank you. Could you tell us a bit about your experience at UOP? What was your favorite thing about UOP?
I loved UOP. If you guys aren't thinking about applying to UOP, I would probably tell you to reconsider. It's a fantastic dental school. Besides the fact that it's the only 3-year program in the country, I mean, I have a whole year less of school than the rest of the country, and I got out a year earlier, which is one reason why I'm a little bit younger and able to do what I'm doing. UOP is very great for general dentists, and again, I'm going to be very honest here. In my opinion, it's one of the best schools to be if you want to be a general dentist. If you want to be maybe an oral surgeon or an orthodontist and you want to specialize, it might not be the best school for you in that sense. You definitely can still do it. A lot of my classmates still did great in specializing, but there are better schools such as UCLA or somewhere else that are more geared towards specializing. But if your goal, and my goal was to be a general dentist, I think it's one of the top schools out there. I think they really teach well how to have great hands and be good dentists. And the UOP was really like a family. All my professors were super nice. I have like a bunch of my professors on Facebook and Instagram, and we still talk. Everyone's really cool. I'd go out and get drinks with some of my professors after class and stuff, or after clinic. Super laid back out there. I mean, it's a super fast paced program, but really great school, really friendly. I really enjoyed that school.
Awesome. We have quite a few more questions.
I'm here for it.
How did you plan to open a practice? Did you plan before residency, during dental school, and what did you focus on?
I'm gonna say that I got lucky. My dad is a dentist, so I already had the practice kind of waiting for me. So I'm a little more fortunate than some in that aspect. Right now, I'm part owner or co-owner with my dad in the practice, but that was kind of always the plan. I didn't buy in until actually this year only, so it took me about 3 years to be ready to buy in. I know a few of my classmates actually just bought practices like a year ago. And I know a lot of them were planning on buying it straight out of school. It does take a lot. You can buy a practice right after school. I kind of recommend, though, being an associate first, just learning how to be a good dentist. Maybe learn from other people who have done it before opening your own practice. Maybe you will see things you do like and you don't like that you couldn't really possibly comprehend until you're out there working. And once you own a practice, you are now not only a dentist, but you are now a business owner. So you've just added another very big hat. So you can definitely do it. Just know it's a lot to take care of. And so I always recommend at least a little bit of time before you go into it. But hey, if you are a gunner, go for it.
Awesome. Can you tell us about your experience while taking the DAT?
Yeah, anything specific or just talk about the DAT?
Maybe just talk about the DAT.
Okay. It's been a little bit of time since I've taken the DAT. It's been like 8 years now, I guess. It's a little different than you guys probably by now, but I studied for about 3 months, my junior year of college, I think. I happened to be in the middle of OChem that year too, so I was dealing with OChem and studying for the DAT. I took like a Kaplan course that was online that kind of kept me in track to study, because otherwise, if I didn't do that, I feel like I would just kind of put it off and procrastinate, which was nice to have to keep me on a schedule. So just find something that keeps you on schedule, in my opinion. If you're a procrastinator, maybe think of taking a class. Definitely take practice tests. Find some good practice tests and sit down for 4 hours or 3 hours, whatever the test, how long the test is, because you need to practice that. If you go in for that the first time, you might not have the mental stamina to take this, or you will run out of time because you're not used to being timed for that. Like it goes by way faster than the SAT or any other test you've taken before. Especially the perceptual ability test, the PAT. That is like nothing you've taken before, unless you've taken a lot of IQ tests. That's a very, very different test. It is very similar to an IQ test, but get ready for that. That is different from anything you've taken before. I mean, you should be able to be good at it because you want to be a dentist, but still, it's very different. So that's my advice for that. Definitely focus on things that you might not be great at. Like, I was really good at OChem and good at chemistry, and I wasn't the best at biology just because I didn't have the attention span to remember everything. So I kind of brushed up on biology, like my notes and stuff from previous classes, to kind of have more general knowledge for everything. If you're weak in a subject, maybe take a class just on that subject. And I think there was something called Chad's videos on YouTube or something like that. A lot of my friends and I found that super useful for concepts that you might not understand. I wouldn't learn everything from just the videos, so that's a lot of time. But if you're struggling with one concept, he really lays it out in a really easy to follow terminology and stuff. So stuff like that. A lot of people are big supporters of the DAT Destroyer. I am not. I think it's overkill. I think it's so much information that it's just, you're wasting so much time. And for me, time is so important that, yeah, like it's going to give you the information you need for the DAT, but you're going to get like essays worth more of stuff you don't need. So try to find something maybe a little more focused. And that could be different since it's been 8 years. So I don't know. But that's kind of my experience.
That was great advice. Thank you. And then we have 3 more questions.
Yeah.
If you paid student loans during dental school, was it stressful?
One more time. Were student loans stressful in dental school?
If you paid student loans during dental school, was it stressful?
I paid off maybe some of the interest in dental school for my loans, but no, I didn't really start paying them off until after school. I would say do everything in your power to have the least student loans that you can, but at the end of the day, you're making an investment in yourself and your career, and there is nothing better than investing in yourself. And so, yes, you will have student loans. That definitely should be a factor for you in choosing a school. Maybe pick a cheaper school if it's still good or if you still will like it there. But I went to UOP, also one of the most expensive schools in the country. I did get a small scholarship, but trust me, I have student loans. And that's okay. I'll tell you now, I easily pay them off. I am really not worried about student loans. I think the default rate across the country for dentists on loans is the lowest. We pay our money off. Like, loans are not an issue. I mean, it's not fun when you pay that money, but you can, trust me, you can afford it as long as you're not dumb. So was it stressful signing the loan? Yes. Was it stressful during school? No, I didn't even think about my student loans during dental school. And I barely think of it now besides when I see my bank account, get my money taken away. Not a big deal.
Awesome. How did you choose to be a general dentist rather than specializing?
It's a good question. So like you guys have heard me say, I love oral surgery, but I didn't only want to do oral surgery. If you're doing oral surgery, you can't do cosmetics. If you're doing oral surgery, you can't do root canals. If you're doing oral surgery, you can't do Invisalign. I like all those things. I have fun doing root canals, surprisingly. It's like, it feels good when you do a nice root canal. I love doing veneers and cosmetics. And I like doing implants, and I like doing wisdom teeth. So general dentistry was just so obvious for me. I get to do everything I want, and so that's why I became a general dentist.
That's a great answer. And our last question is, if you could change something about the practice of dentistry, what would it be?
That's a great question. If I could change something in dentistry, what would I change? That is actually a great question. Probably a lot of things, but I'm trying to think of one. Off the top of my head, 2 things. One, if somehow I could change for patients not being so damn scared of the dentist, I would change that in a heartbeat. I don't know what the hell it is about people being so freaking scared of the dentist, but it is a pain in my ass at how scared people are. I always joke, like, I mean, I'm making it sound like it happens a lot. It's probably like 5% of my patients that are that scared, but it is a lot to deal with when it's those 5%. And it's always funny when I walk into the practice or walk into the room and the patient, I say, hey, I'm Dr. Eisen, nice to meet you. And they go, hey, I just want you to know I hate the dentist. I hate hearing that because I'm like, well, I'm a nice guy, I swear. Sorry to hear that. Just gotta move on now. If I could change that, I would. And then the second thing I would change is dental insurance. You guys don't know anything about dental insurance yet, but dental insurance sucks. The average dental insurance in 1975 was $1,500 a year. And in 2021 or 2020, the average dental insurance is still $1,500 a year. So it covers like nothing on average. And patients blame us for that. They think it's our fault that we're cost so much and insurance covers like nothing. It's like 1 crown. Back then that covered a lot. Now it covers like nothing. So if I could change that, I would. Hopefully one day, maybe one of you guys can fix that for all of us, or as an organization, we all can. But those are probably my top 2 things. Better dental insurance, more coverage for people, and fear.
That was a great answer. Thank you. And that was it for our questions.
Any other ones? Anyone want to know anything about the cases, anything like that, or I answered everything?
I think you answered everything. That was a great presentation.
Thanks, guys. Appreciate it. Well, if you guys have any other questions, you guys have my Instagram, my email, whatever you guys want. Thanks for having me. I really appreciate it. Good luck. You guys are going into an amazing field. Enjoy it and find your passion.
Okay.
All right. Bye, guys.
Yep. Okay. Thank you guys for, and then thank you, Dr. Eisen, for giving such a informative presentation. And the quiz link is up in the live chat and all chat, so please check them out. And yes, thank you guys so much. And I'll